Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Okay, everyone. Well, this is we're getting close to the
close to the beginning.
end. Right, close to the beginning. We have the sunset. The sunrise is gone. Now it's all full blown, right? So today we have a great guest that Dr. Mencia invited. Maybe you'd like to introduce her, Dr. Mencia.
Good morning, Trinity.
Good morning.
Yeah. How are you?
I'm doing great. How are you guys doing?
We are doing
Early
great.
in the morning, right?
Early in the morning.
That's what
Very
he does.
early, yeah.
I think it's your test, right? You bring new people on, you have to see how they function early in the morning.
Absolutely, absolutely. So Trinity Boszko is a perio and specializes in implant.
Mm-hmm.
So we met and she loved the office and people, they all fell in love with her. And they said, oh, she's so beautiful. She's so dynamic. So I think she's going to be a perfect match. Mm-hmm. And when I read on her bio, she also studied psychology like I did. Mm-hmm. So, and I think that's very important when you go and see your dentist, that they are able to to understand the level of anxiety that you might have. I was just giving a huge lecture this past Thursday, and we have over 40 attendees. That's why my voice is off a little bit.
Tell me about the lecture and what you do.
It was a lecture on blood thinners, talking about blood thinner and the indication of blood thinners and how we use it in dental department, for example. If the patient is on Coumadin, which is one of the oldest blood thinner, versus Xerorta, one of the newest thing out there. Xerorta, you can stop the day before, do the procedure, do extraction. If Dr. Boszko have to do major surgery with the tissue, we don't want a lot of bleeding in there. So we want to stop the medication, but at the same time, the person is taking the medication for a specific reason, to prevent clot formation. And if you form a clot in your leg, it's what we call a DVT. If it's in your lung, it's a pulmonary embolism. It's even more dangerous. And if it goes to the brain, they can give you a brain stroke. So it is important, and that's one of the beauty of the center, that we are able to work hand in hand, the medical department with the dental department, regardless if the patient that come to see Dr. Boszko for any procedure, regardless if that patient is my patient or no, we consult each other. I say, how do I handle this? What do I do for this? If the patient is taking sometimes Plavix, aspirin, we work together. There are so many medication out there now for blood thinner.
Mm-hmm, absolutely. And definitely one of the things that, as a surgeon, that we think is so crucial, dental treatment, for the most part, is elective. It's not, there are certainly emergencies, things that we are dealing with patients who are coming in pain or infection, but a lot of times the treatment that a patient is going to come in for dental-wise is not going to trump any kind of dangers that they're having for having a heart attack or stroke. Obviously, that's more important because that's life-threatening. So as a surgeon, always, it's so important to get a medical consult anytime a patient is on any kind of blood thinner. And a lot of times, the physicians will come back and say to us, leave the patients on the blood thinner because the risk of a little bit more bleeding during surgery is less of a risk than taking the patients off the blood thinner and risking them having a stroke or a heart attack. So a lot of times, as a surgeon, then I have to kind of determine, okay, well, how necessary is this procedure and how big of a bleeding risk does the patient have? And, you have to weigh those options and determine if surgery is a good time for that.
Excellent. Yes.
So I have a question about this. Of all our body, do gums bleed more than the rest of our body?
No, actually, there's been studies that they have done where they've tested how much blood you lose during a surgical procedure, and for the most part, it's pretty minimal. So most of the time, I mean, unless you're having patients who are on really, heavy blood thinners, the bleeding that patients experience during surgical procedures in the mouth are pretty minimal. So
yeah, see, you never know about that, but I know that my husband has he has an artificial knees and hips, and whenever he has to go to the dentist, they make him take an antibiotic.
Yeah, absolutely. That's something that is pretty across the board with artificial joints. They don't want you to get an infection of that joint. And so anytime that you bleed anywhere in your body, not just in your mouth, you have a chance that bacteria can get into that wound and into your bloodstream through that. And so especially when you're doing procedures in your mouth, even brushing your teeth and flossing when you're bleeding, this is something that you kind of have to be careful of, but you can't put patients on antibiotics all day, every day. During dental procedures, they tend to bleed a little bit more than they would during flossing and brushing. So that's when when their doctors will recommend that we put them on antibiotics just to kind of have it in their bloodstream in case any bacteria from their mouth gets into the bloodstream, that it doesn't get into their artificial joint.
And sometimes if they're going to do deep cleaning or anything like that.
Yeah, exactly. Deep cleaning, certainly they're going to bleed, more than they would brushing and flossing. So.
I can picture Dr. Mencia's patients. They come in for something else. They have a wound on their leg. They have a headache. And the first thing he does, I know it. He looks in their mouth. He says, "What are you looking at my mouth?" He says, "Open your mouth, with the tongue." And what they don't know is you're looking at their teeth.
Yes. We had a patient that came yesterday to see us for her regular monthly visit with us. And she said, I had this severe left ear ache. So Donna, my third-year medical student from Nova, and I were looking at the patient. And the way she described him, we said, well, maybe it's your mouth. No, it's not my mouth, not my mouth. So we thought it probably is TMJ or something else going on. We checked the ears anyway, just to be certain. And the ear looked fine, so it was not the ear. So he said maybe some sinus infection, something going on. So we put her on some antibiotic to try to dissect where this horrible pain she's getting on the left ear. But sometimes, oral disease might not present with toothache, right?
Yeah, absolutely. You can have pain from your teeth that can be referred to different areas, even within your mouth and also outside of your mouth. So certainly, ear pain can come from the throat, and it can come from sometimes infection from your tooth.
Now, we make a very light and lively show, so forgive me. You never know. But when people say you're a pain in the neck. Where does that come from?
Oh, when you have pain in the neck, it's horrible. You cannot. It's like when you have pain in the funny bone. You can see.
Where's your funny bone?
And the bottom of your spine.
I don't even know that.
Yeah,
there's a funny bone there.
There's a little bone that hanging there loose.
Oh, but I thought that's your coccyx.
The coccyx, yeah.
And that's called your funny bone?
Some people call it a funny bone.
I just learned something today.
I can see it. I can do this right
now. But talking about, we hadn't planned on talking about the coccyx. We will talk about dental, but I wanted to ask you, there was someone that I know recently fell on her coccyx.
Oh, no.
And when I told her, she was in a lot of pain, and I said, make sure you go get one of these little cushions.
The donor.
The doctor never recommended anything like that, but it's pretty painful, isn't it?
It is very painful. It's hard to see it. And, it's usually heal by itself. You cannot do surgery there. So you just let it heal by itself. And so it's very hard to see that. You don't want that to become a loose joint. You want to let the bone heal up. Because sometimes when a bone breaks, if there is enough separation between the portion that broke and the remaining portion of your spine, so this is going to become like a joint by itself. So that bone is going to move back and forth.
I have to tell you, Trinity, something.
Sure.
Dr. Mencia and I are planning to do TV on real live TV and put it on YouTube. And I was picturing his trying to show about the coccyx here on the radio. It doesn't show very much.
Yeah,
But
right.
on the TV, it's going to show. In fact, we ought to get even a little... You'll have to get one of these
It's a model,
skeletons
yeah, a little
so
model.
we can show it,
We can
because that's
show.
what we're going to do, right?
So tell me about perio. What is who need to see a periodontist?
So, in general, usually patients will be referred to their periodontist from their general dentist. So, periodontists are basically specialists in gum disease, and also we do surgical procedures in order to replace missing teeth. And so, basically, you'll come to your periodontist either if you have severe gum disease that can't be treated by a general dentist, or if you want to replace your missing teeth with implants, or also we do soft tissue grafting. So if patients have been told by their dentist that they have recession, then that's something that I can also treat in order to cover the teeth. If they have sensitivity to hot and cold, sometimes they have recession, and that can be alleviated with surgery sometimes. So,
Isn't it bleeding gums that really tell you that you have periodontal disease?
Mm-hmm. Yeah, bleeding gums is a sign of, at the minimum, gingivitis. And so gingivitis is something that we consider to be reversible, which can be treated by a general dentist. Usually you'll get just a cleaning and a prescription to improve your oral hygiene, brushing and flossing at home. But then at some point, gingivitis will progress into periodontal disease, which is irreversible, meaning that at that point you're starting to lose some of the structures that are supporting your teeth, meaning the bone that surrounds the teeth. And so once you start to lose bone that surrounds the teeth, and the teeth lose their support, then you need to see a specialist like myself in order to stop that process from getting out of control and leading to you losing your teeth.
And so I want to tell you, the name of this lovely guest is Trinity Boszko, Boszko. And she is going to be working not only in the commercial dental department of the adult and geriatric, A and G. Sorry,
AGI.
AGI. So I've had this other name for so long, AGI, but also going to be probably working up in the Boynton Beach office.
In the Boynton.
Sure.
Mm-hmm.
So that makes it. You're gonna have your case, and you have to travel right back and forth. No, they'll have everything there for you, I'm sure.
Yeah.
Yes. And one of the things that you do is crown lengthening.
Mm-hmm.
What is that all about?
So sometimes there's different kinds of crown lengthening. There's two different kinds. So there are some people who have a gummy smile, meaning that when you smile, your teeth, it's not just your teeth that you see, you also see a lot of the gums. And so this can be sometimes an issue that can be solved with surgery. Obviously, you need to see your specialist, and your specialist can evaluate you for that to see if you're a candidate for the surgical procedure to alleviate that. But this is more of a procedure where you can move the gums up so that more of the teeth are showing. Sometimes when people are born and grow into adulthood, if you notice in children, their teeth look a lot smaller than adults' teeth. And so that's not just baby teeth, but even their permanent teeth. At first, they look shorter. Over time, the gums move to their position that they're supposed to be, which shows the full tooth and makes the tooth look larger. However, in some people, it doesn't happen. And so the gums stay lower down on the teeth, and the full tooth is not exposed. And so when people smile, it looks like you're seeing too much gums. And so I can do a surgical procedure to remove some of the gums so that it looks more natural. So that's one kind of crown lengthening. That's called aesthetic.
What did you call it? Called gummy? What did you call the name of this?
The smile.
No,
a gummy smile?
A gummy smile.
Yeah.
I never heard that before.
Yeah.
A gummy smile. Okay.
Yeah, sure.
Yeah.
So that's one kind, and so that's called aesthetic crown lengthening. That's purely aesthetics. And then the second kind of crown lengthening that we do is when a patient has decay, and that decay goes closer to the bone that surrounds the teeth. And so what can happen is when crowns are placed on teeth that have decay that goes close to the bone doesn't like that. Crowns are kind of a foreign object, and your bone is an organ in your body, and I'm sure heard of foreign body reactions. So when you put a crown close to the bone, you get that kind of foreign body reaction. And basically, in order to fix that, we can remove some of the bone around the tooth so that you can make sure that you get rid of that foreign body reaction.
Yeah, those are things we've never discussed that before. I'm glad that you're bringing that up. So you really love what you're doing. I can just feel the enthusiasm.
Absolutely, I really love perio.
And a lot of times people have the misconception that, of course, if it's one of your front teeth that you lose, you're gonna, they're gonna run to you.
Absolutely,
because my smile,
yeah,
I have a tooth missing.
It's an aesthetic issue.
I cannot go
right.
for that interview. Yeah. But they think if it's one in the back, then that is not that important. That we can let that go. What happens when we have a tooth that has been extracted from the back? What happened to the rest of our teeth?
The patient's mouth? So basically, your teeth are they don't stay in one place. That's why we can do braces, because people have crooked teeth. You can put pressure on the teeth and they'll move into a different place. And so the same thing will happen a lot of times when you lose a tooth, is that you have change in the way that the forces are placed when you bite. And so now you're missing a tooth that used to bear a load. And so now the teeth around that tooth, next to it, in front of, behind, and below that tooth are now shifting because that tooth is not there anymore. And so what it creates is kind of this 3D puzzle that begins to shift around, and then to fix it, it becomes very complicated the longer you let it go, because you have teeth that are taking the place of where that tooth was, and to replace that tooth now becomes more complicated.
It's a good explanation.
Yes.
I think she has some of what you have. She can take a difficult subject and make it simple.
And simplify it. Yes. It must be her background.
Yeah, that's
psychology.
She just has that.
I usually use my finger when I talk to the patient. I say, you have this, you lose one, you don't have an empty space. Things is going to migrate, and you won't have the empty space no more. It's going to be difficult. Because sometimes they want to think about the implant, and the sooner you get it done, the better. Some people during the extraction, when they see the perio, they say, okay, the extraction is done, and the periodontist start working right then and there to see if we need some bone graft, because you have to build the base where you're going to put that implant. So, it's important that you make the decision. If you know you're losing a tooth, make it earlier than later.
So what makes the difference in a crown or an implant? Can you do the same with both?
A crown, well, it depends. So a crown is something that you put over the top of a tooth that what we call restorable, which means that tooth is still savable. So if let's say a patient comes in, they have decay that goes to the nerve, then the determination is, well, is there enough tooth structure left once we remove all of the decay that we can keep that tooth? And then if we can, then we go ahead, we do the root canal, and we'll crown the tooth. But if the decay is so extensive that there's not enough tooth left over when it's all gone, then we say, okay, the tooth has got to go. And then we talk about implants.
Years ago, this was a very different subject. This was so, like 20 years ago, implants was way out there. I don't even know, maybe people with very serious accidents had them, and everyone had dentures. Right? But dentures now is a no-no. Dentures are a no-no, aren't they?
Dentures, I mean, it depends on what a patient can, afford. Obviously, it's not an ideal situation to have a denture. A lot of people find them to be extremely uncomfortable. Obviously, they're unaesthetic. I have patients actually who are, older in age and still dating, and they sleep with their dentures in because they don't want their significant other to know that they're not their natural teeth. And we always recommend to our patients, you shouldn't sleep with your dentures in. I mean, this is not something that needs to be in all day and all night. You have to take it out because it accumulates bacteria and these kinds of things. It needs to be cleaned, and you need to give your gums time to breathe, just like you don't want to wear a Band-Aid 24 hours a day and never take it off. You need to let your skin breathe. It's the same kind of thing with a denture. So there are a lot of things with dentures that are negative, and with full dentures, certainly they can be very difficult to eat with. So it depends on what the patient can tolerate aesthetically and comfortably wise. But definitely implants are closer to natural teeth, and patients who have implants, if they're able to keep them clean and whatnot, they can last for a very, very long time. And certainly they're easier to eat with and better all around, definitely.
Because, if you take good care of of the tissue around your teeth, that's what's going to give support. Your teeth are meant to live for thousands of years. And we tend to forget that. We tend to think that as we age, we are supposed to lose our teeth. And that's not true.
No.
A lot of people, you can die and your teeth will be there for thousands of years.
You've seen that with the mummies, haven't we?
Right, exactly. So, we are not supposed to be losing our teeth, and that's why, to have Trinity working with us, with the rest of the team of specialists in the dental department, we can do a lot of good.
When you talk about both of you having psychology backgrounds, if anything, it makes someone feel bad or negative or they lose their sense of worth, it's taking out those dentures and looking at their mouth. I mean, I could hardly recognize my mother. I didn't know. I never saw her without her dentures in, and one day I did, and I couldn't have recognized her if you put her with other people. It's just a total change of a look.
Right.
Yeah,
right.
It does. Yeah, because your teeth give your lips support. And so, you see people, that's stereotypical look of people who don't have teeth. And people always make that, funny face where they put their lips inside their mouth because teeth are not, they're also there to support your lips and support the structure of your face. And without them, you look differently even when you're not smiling, certainly. So.
And now, even if someone can't afford what maybe the total price is, they can do it on a slow payment. You have insurance, don't you have?
Well, we have plans that we use in the centers.
Care something.
Care credit.
Yeah.
And where you don't have to, they charge you 0 interest. And as long as you pay it within the given time that you requested, let's say 1 year, 2 years, what have you, as long as you pay no interest. You just have to pay the money back every month. There's no penalty if you pay earlier than what you're supposed to either.
The one thing that, I love Medicare, that fact that it will help older people. Isn't it strange that dentistry, other than just maybe a cleaning or something, but they don't take care of things like that?
No,
I don't know.
Yeah.
What happened there? What do you think happened? Why they didn't think that was so important?
I don't know. Medicare only covers denture once in a lifetime. So if they...
Which is ridiculous,
by the way.
It's actually ridiculous.
Even somebody who has a denture, they're going to need it replaced. The thing is that the bone that's underneath the denture is what supports the denture and the structure of the denture. And that's a dynamic thing. Your bone is an organ in your body, just like your kidneys are constantly filtering your blood and your heart is constantly pumping and your lungs are constantly breathing. Your bone is also changing morphology and adapting to pressures that are put on it. And that's the other thing about dentures is that over time, when you have a denture in your mouth, the pressure that the denture is putting on the bone causes the bone to shrink. And so also, the longer you have dentures in, the more difficult it is to place implants later in life. If you change your mind and you want to have implants, then there's a higher chance that you may need, bone grafting procedures in order to make that possible. But, regardless, if you're going to stay in dentures, over time, that bone is going to shrink. It's like buying an extra large T-shirt for a skinny person. Eventually, it's going to be too big.
See?
Yeah.
She's doing it.
He's
just doing it. He does the same thing. He can take a difficult subject and I'm laughing because I always tell him, you make things so interesting. But I didn't know that. So in other words, your gum, the longer you have dentures, then it weakens the bone structure.
Absolutely, yeah. And then, over time, then your dentures will not fit and you need a new set.
Now, aren't there also dentures where now they have they do have implants in a few places that hold your dentures in?
Yeah.
It's a whole new system, isn't it?
Yes, and that
Snap
actually...
on.
What?
Snap on.
But that's so that they don't fall out.
Yeah,
Right.
exactly. Yeah, especially the lower jaw dentures. They tend to be difficult with retention. So a lot of times The uppers they'll stay in better because you have the roof of the mouth, which helps the dentures to suction into place, and those will hold pretty well. But on the bottom, you don't have that because your tongue is there, so the denture has less to hold on to, and so then you can put implants there, and it can help the dentures to be held in better. It definitely helps with eating function and everything like that dramatically. So
this is a whole new field. I mean, it's a field that isn't new for you because you've studied in school, but I don't think people have ever realized the seriousness of it. You're unusual, Dr. Mencia, to have a whole dental department along with your medical department.
It is. And, when I had the dream of putting a geriatric center that had become now really an adult and geriatric, because a lot of younger individuals will come and get their care. We want to cover the whole body. And that's one of the things I learned in psychology. The brain and the rest of the body is all attached, and we need to work together. And that's one of the main things. That's why so many lawsuits and so many things going on, because the consultant are not sort of communicating with each other. So, I say I have to have a podiatrist to take care of the feet. I have to have a neurologist to help me take care of the brain, and we need a dental department to take care of the patient.
You've done very well. Well, Trinity, thank you for joining us, Trinity Boszko.
Thanks for having me.
And let's just get everybody to call if you want to make an appointment, either for dental or for medical. It's 954-489-1345. That's the Fort Lauderdale office, 954